public health sector has been grappling with the issue of health equity, particularly in the terms of racial and ethnic disparities. Today we will examine the issue of health equity and the ways in which it intersects with race and racism. The issue we will be exploring is the topic of racial disparities and inequities towards Black people in the healthcare system. The stakeholders addressed in this issue are the City of Philadelphia and the Pennsylvania Public Health Department. The City of Philadelphia comprises the individuals and communities that play a role in this issue. This spans from Black Philadelphian residents who experience racism in healthcare, as well as researchers who study the historical effects of the role racism has played in healthcare and how it is perceived in everyday language and embedded in health research. The Pennsylvania Public Health Department comprises the state legislative and action taken in response to racism in the healthcare system. It is the voice of the healthcare system in Pennsylvania and their perception and response to this issue. The fault line is Pennsylvania as a state, but also goes down to the city level of Philadelphia. Through this video, I hope to showcase and shed light on how African Americans face discriminatory inequities and disparities due to perceived everyday racism caused by racialized constructs in the healthcare system within Pennsylvania. The article Critical Race Theory, Race Equity, and Public Health Toward Anti-Racism Praxis by Chandra L. Ford explores the methodology of critical race theory as it allows the proper space to discuss race consciousness versus colorblindness and presents the necessities for understanding racialized constructs and mechanisms. In the article, Ford states that eliminating racism is central to achieving health equity, but this requires new paradigms that are responsive to structural racism's contemporary influence on health equities, and research. It is important that this issue can be properly discussed with the correct terminology to dissect this issue in parts rather than in whole. The information gathered in this article explores the concept of critical race theory and how it can be applied to public health. Critical race theory is an approach that examines how race and racism intersect with other forms of oppression to shape social inequalities. Ford argues that applying critical race theory to public health, we can better understand the root causes of health disparities and work to eliminate them. The role of racism in medical research has a lasting impact on the healthcare of Black individuals, resulting in significant disparities and inequities in healthcare outcomes. The article highlights the relationship between racism and health disparities. It argues that racism is a social determinant of health that contributes to the disproportionate burden of illness and mortality experienced by racial and ethnic minorities, specifically African Americans. The article suggests that the healthcare system itself is not immune to racism, that this can be seen in medical research practices that have perpetuated negative stereotypes and misconceptions about Black bodies and health. These misconceptions have contributed to the ongoing health disparities and mistrust within Black communities. The article emphasizes the need to address the legacy of racism and exploitation in medical research and to increase Black participation in research and clinical trials to improve healthcare outcomes and reduce health disparities. Overall, the article supports the idea that African Americans face discriminatory inequities and disparities due to perceived everyday racism caused by racialized constructs in the healthcare system within Pennsylvania. In another article by Raina Hogarth titled The Myth of Innate Racial Differences Between White and Black People's Bodies, Lessons from the 1793 Yellow Fever Epidemic in Philadelphia, Pennsylvania, she supports the topic of racism in healthcare because she understands that racial disparities have been visible in health throughout history and is bolstered by the structural racism that lies within society. She believes that Black people have been stigmatized to be less than white people, and in medical history were even incorrectly believed to be physiologically different as well. In the book Medical Apartheid by Harriet Washington, a writer and medical ethicist, she says, in the absence of evidence, medical schools taught that Blacks had smaller brains than whites and were thus less intelligent, that their blood was thicker and their skin less sensitive to pain. In her article, Raina Hogarth highlights the outdated belief in such innate differences between Black and white people. She argues that this belief is not based on scientific evidence, but rather on racialized constructs that were prevalent at the time. This belief has persisted and has led to many discriminatory practices in healthcare, including the withholding of proper medical care to African Americans due to perceived biological inferiority. The importance of understanding how the racialized constructs have shaped the perceptions of the medical community regarding African American bodies is crucial in understanding the effects that still linger today. The medical community's racist assumptions about African Americans' bodies perpetuated a cycle of mistreatment and neglect that still exists today. Acknowledging the historical roots of medical racism is crucial in addressing the systemic health inequities experienced by African Americans today. Hogarth emphasizes the importance of recognizing and challenging the historical and ongoing impact of racialized constructs in healthcare and the need for a more inclusive and equitable approach to healthcare. In the 18th century, there was a widespread belief that black people were inherently biologically different from white people, which led to a lack of concern for their health and well-being in medical research and treatment. Many African Americans were used as test subjects without informed consent, and their experiences were not documented. This form of racism and exploitation has had long-lasting effects on the black community in Pennsylvania and has led to a distrust of the healthcare system. This distrust has contributed to disparities in healthcare access, with African Americans receiving less care and experiencing worse healthcare outcomes than their white counterparts. Mentioned in Hogarth's article, the yellow fever epidemic of 1793 in Philadelphia, Pennsylvania played a significant role in shaping the widespread belief that black people were immune to the disease and could be used as test subjects in medical experiments without adverse consequences. It is important to know that prominent physicians and researchers of the time used faulty and biased research methods to support their claims. The faulty and biased research methods used to support this myth reflect the systemic racism that exists within the medical field. This belief has persisted throughout history, leading to a lack of proper medical care for African Americans, who have been viewed as biologically different and inferior to white people. The consequences of this belief have led to the withholding of medical treatment for African Americans, resulting in negative health outcomes and higher mortality rates. This underscores the importance of recognizing and addressing systemic racism and racialized contracts that exist within the healthcare system in Pennsylvania and beyond. Ford's article, Critical Race Theory Toward Anti-Racism Praxis, highlights the importance of understanding and addressing the legacy of racism in medical research as a way to promote anti-racism praxis in healthcare. She argues that promoting black participation in research and clinical trials can help reduce mistrust within black communities and improve health outcomes by ensuring that medical interventions are effective for all individuals, regardless of race. This is particularly important given the ongoing health disparities experienced by black individuals who face higher rates of chronic diseases and lower life expectancy compared to white individuals. Therefore, increasing black participation in research can help reduce the impact of racialized constructs, promote more equitable healthcare outcomes for all individuals. In an article written by Rachel R. Hardiman, titled Examining Racism in Health Services Research, a Disciplinary Self-Critique, she states that the ideology that guides the City of Philadelphia's view of the issue of racism towards black people in healthcare research is one that values equity, justice, and inclusion in healthcare. The City of Philadelphia recognizes the existence of systemic racism and its negative impact on the health and well-being of black people in the city. They acknowledge that racialized constructs in the healthcare system have resulted in discriminatory inequities and disparities for African Americans. The city's work on the history of race and medicine has shown that racism towards black people in healthcare research is deeply rooted in the history and culture of the United States. The city is committing to addressing the legacy of racism and exploitation in medical research and increasing black participation in research and clinical trials. They believe that prioritizing equity, justice, and inclusion in healthcare, they can improve healthcare outcomes for black individuals and reduce health disparities. The city is actively working to address these issues through various initiatives and policies aimed at dismantling systemic racism in healthcare. The ideology of the city can be seen as a positive step towards addressing the issues of racism and discrimination in healthcare. However, it does not necessarily mean that these issues have been fully addressed or eliminated. There may still be discriminatory practices and attitudes that persist despite this ideology, and it is important to continue to examine and address these issues in order to achieve true equity and justice in healthcare for all individuals, including African Americans. This is possible due to the efforts of the City of Philadelphia acknowledging the existence of such discrimination and seeking to actively combat it. Additionally, the use of language in discussing this issue is important as it reflects the values and intentions of those working towards change. By emphasizing the importance of equity, justice, and inclusion in healthcare, the City of Philadelphia is taking a proactive stance towards addressing the issues faced by African Americans in the healthcare system. This is crucial for promoting trust and improving healthcare outcomes within Black communities. Overall, the City of Philadelphia's actions reflect a commitment to addressing systemic racism within healthcare and promoting equal access and treatment for all individuals, regardless of race. In the article titled Implicit Bias, published by the Pennsylvania Public Health Department, Their belief on this topic is guided by the importance of equity and justice in healthcare and recognizes that systemic racism and bias are major barriers to achieving these goals. By acknowledging the problem and taking action to address it, the Pennsylvania Public Health Department is contributing to a larger effort to reduce health disparities and promote equity in healthcare for all individuals, regardless of their race or ethnicity. According to the Pennsylvania Department of Health's Office of Health Equity, the effects of racism on health outcomes are significant and long-standing. The department has identified several priority areas for addressing health inequities, including improving access to quality healthcare, promoting health equities in all policies, and enhancing public awareness and education about the impact of racism on health. These efforts include providing resources for healthcare providers to better understand and address racial disparities in healthcare and supporting community-based organizations to promote health equity and address social determinants of health. By acknowledging and addressing the role of racism in healthcare, the Pennsylvania Public Health Department is working to reduce discriminatory inequities and disparities faced by African Americans and other marginalized communities. In the article, state legislation to declare racism a public health crisis and address institutional racism, the Pennsylvania Public Health Department views the issue of racism towards Black people in healthcare research as pervasive and deeply rooted within the healthcare system, occurring in various settings including hospitals, clinics, research institutions, and academic medical centers. All of this shows that even institutions responsible for public health recognize the problem of racism and bias in the healthcare system. The acknowledgement of this problem is the first step towards addressing it. The fact that racism occurs in various settings highlights the systemic nature of the issue and the need for comprehensive solutions. Additionally, it suggests that this issue is not limited to one specific aspect of healthcare, but is a broader problem affecting the healthcare delivery and research. Overall, there needs to be a comprehensive approach to address racism and bias in the healthcare system. It needs to be beneficial for improving health outcomes for Black individuals and reducing health disparities all around.